I'm Dr. Adriana Potter. On the Benefit Yourself series today, I'm going to be talking about three main techniques that I use for kinesiotape for the hand and elbow. This is usually very good for the patients that have issues with the wrist area or the thumb and elbow. I'm actually having a little issue with my elbow tendonitis in here, the lateral side in here. I had some cup done. And I had some myofascial work before I'm doing the tape, so it optimizes the benefit of the tape. Okay, like I mentioned before, the kinesiotape it is usually indicated for helping facilitation or inhibition of the muscle, creating space and helping the blood flow in the area and help with the healing. My patients with VDS really like it as long as they don't have any reactions to adhesives in general. The kinesiotape usually it is latex free, so you should be able to use it. All right. For the elbow tendonitis that I'm going to use for today, you're going to need a piece of tape about 5 to 6 squares. You're going to start to the front of the wrist and you're going to end right above the elbow. Okay. Just similar to the other techniques, you have what we call the anchor side, and you're going to do that in both sides. In the middle of the tape is actually called the therapeutic zone, which is where most of the treatment is being delivered because of what the action of the tape. Okay, for the elbow, you're going to start with the wrist flexed, the hand in the fist, glue it on the top of the wrist. And remember, it is heat activated, this adhesive, and then so rub it off before you move on. This is the anchor on the bottom. And then we're gonna finish with about 1 finger to the top of the length. So it's gonna be slightly above to my 1 to 2 fingers above to the length of the original tape. If you put too much tension, what's gonna happen is gonna be very, very itchy, and sometimes the skin will break out. So you don't wanna be doing that. If you're not sure, put less of resistance to begin with. All right, so with the wrist flexed, you're gonna pull the tape, lay it over, right? And again, this is my anchor. Roll your hand over the area, that's the therapeutic zone for the tape, right over the belly of the muscle. I could have finished this a little bit longer, so you know. And then you pull it, the anchor on the top that has no tensions. So the anchors, top and bottom, has no tension. We don't want a tension in the area. We want the tension to be in the middle of the therapeutic zone, okay? So the second part of this tape, it is a little bit 2.5 to 3 spaces. And this one is a little bit tricky to put on your own because you want to lay like a Band-Aid. It requires a little finesse to do it. So if you have somebody helping you, that would be easier. But you usually want to pull it in the middle and lay it like a Band-Aid. All right. So for me, I had to kind of do it with one hand here. Keep the elbow a little bit bent, and you're going to go right over the belly of the brachialis muscle in there, which is this muscle here on the top, and anchor and anchor. Alrighty, so this is that technique. So rub it to really activate the heat into this tape. Okay. Alrighty, so the second one, it is for the thumb. Okay, if you're having issues that bringing your thumb towards the palm hurt, we want to actually put the tape on the back of the thumb. If you have issues with the thumb coming backwards, and every time you bring back it hurts, you want to put the tape on the bottom to the palm here towards the wrist. Okay, for this one, we're gonna need about, let's see, 1, 2, 3, 4, 3.5 tape size, and you round it. We're gonna actually wrap around the thumb, so we want to cut it 1 of the square length. We're gonna split. Okay, it is split, and we want to round this edge as well over here. Okay, so for me, I want to actually put it slightly over here. This is the curving area that kind of creates a little pain when you're using your thumb a lot. So for me, is more like for, it depends what you're doing. That's a nice, when you're working with your therapist, they know exactly what you do it. But try one way. If it doesn't work, try the other way. There's no right or wrong. People usually don't get worse by doing this tape, so that's the nice thing. If it doesn't work that way, try the other way, right? So we're gonna put it here in one thumb and wrap it. The same thing here, so activate, do the same thing here, putting around the other thumb and wrap it, all right? So right here. And then we're gonna pull the tape. Here's my therapeutic zone, right? Bring the thumb down, stretch it, and bring it here. Glue it, rub it off, and roll it. All right, so this is the thumb. It's kind of helping me to keep a little bit in neutral. So if you want more extension, the tape's gonna go that way. If you want more flexion, the tape is gonna go that way. So it does matter the direction and the tension of the tape. And again, you wanna make sure that it is nice and gently put. And the last one is, I didn't learn in the course, I learned just by doing it, is the spiral tape on the wrist. It feels awesome when you're having a lot of pain on the CMC or around your wrist area. You're gonna put about 4 squares, okay? And round the edges again, all right? Okay. I stay there. And this one, you're gonna either start from the pinky side, go around in here in the spiral and end the other way. So, or you could do the other way around. You can do from the thumb side, spiral, and go to the other way. So there's no right or wrong. So I'm gonna do both wrists, different directions. Starting on the pink side, a little bit on the wrist. For this one, we're gonna keep the wrist in neutral, okay? So fold your tape all the way to your anchor. That's my anchor. All right, so keep it in nice and neutral. And you're gonna spiral around your wrist. So it's not cutting the circulation in here. And I'm putting about a little bit more than a finger. I will probably almost stretch almost all the way. Maybe like a 2-3 fingers stretch. As long as your skin can tolerate that much friction, it was okay, it won't break it out, you can try. So when you're not sure, put less resistance, okay? So that's this one for that thumb. Alrighty, for this wrist. I'm gonna do one for my other side, so you can see a little bit of the difference. And again, round the edges. For this one, I'm gonna start on the thumb side, okay? So that's my anchor, no resistance, putting right on top of my thumb area here. Hopefully you can see it, right there, right? And you don't wanna be doing tape over tape because usually doesn't adhere as well. But for the purpose of this video, I'm doing it. In general, you don't want to be doing tape over tape, okay? Now I'm pulling my anchor in here, rubbing this one. Again, like so, this is the resistance. So I'm going to show you a little bit slower. Pulling in here, see? Now I'm going to turn my wrist in here. But you can see how the tape does not over... Oops, let me show you here. There you go. Alrighty. All right, so you can see there's a gap in between the tape, just like this one. There's a gap in here. There's also a gap in there, okay, of the spiral. So it spirals around the wrist. And you can see how it creates a little bit of that gentle compression. And it's not straight around. If you do straight around, you're gonna cut the circulation. So you're gonna make sure that you're doing nice and slow, just around with that nice overlap in here. And so you're not cutting the circulation, but you create a nice gentle hugging feeling. That's what I tell my patients, a hugging feeling to the wrist. I like using these tapes versus using the brace, because the brace completely immobilizes. There's a time and a place to wear the braces, is when you actually have a really bad flare that you need to not move at all. And then you should be probably using icing or heat or anti-inflammatory. But in general, we want to use the tape because the tape still allows you to move and the brace doesn't. So you still have a lot of function of your hand when you're using the tape, and it's still doing the therapeutic portion of the kinesiotape. Alrighty, so these are the three main techniques that I use for the wrist, hand, and the elbow section in here. Hopefully this was educative for you, and you have any requests for any specific area of your body that would like to have a tape, put it in the comment notes, and then I will make sure to get the video done for you and ask questions. And I'm always here to answer your questions and make custom videos for my viewers. My name is Dr. Adriana Potter. I am the author of Let's Get Physical and Benefit Yourself series from Dr. Potter Physical Health. Don't forget to subscribe and press the bell button for future videos. Have a great day.